Okay, so some of the classes that you'll have to take are biology, chemistry, and physics. And these are kind of like the major categories that science fits into. And as you move into high school and college, a lot of like schools will require you to take these classes. So we'll start with biology, and that is the study of living organisms and their vital processes. So, for example, you can think of it as like functions inside and outside of your body. So it'll include things like the environment, but also like cells and DNA. And this can cover other fields like botany and conservation. It includes evolution, genetics, marine biology, and microbiology. So it spans a lot of different fields, and it's not only talking about things within your body. And then we have chemistry, which studies the composition, structure, and properties of substances. So those are typically elements and compounds, if you've seen the periodic table, and the transformations that they undergo. So kind of different experiments to manipulate the elements. And then finally, we have physics, which studies the nature and properties of matter and energy. And this includes mechanics, heat, light, and other radiation. So a lot of the times when we think about physics, we think about like throwing the ball and calculating the velocity or the speed of the ball. But physics includes a lot of other things such as like heat and wavelengths. And then we'll go over our biology major. So biology is the most common major for aspiring physicians and surgeons. And a study actually showed that 48.7% of employed physicians and surgeons chose to have biology as their undergraduate major. And classes that typical biology majors will take are anatomy and physiology, so kind of like the structure of bodies, biochemistry, biology 1 and 2 in labs. So a lot of these majors will require you to take labs and other classes that include a lot of coursework and textbook work. You'll take calculus because math is really important in STEM fields, and they're very closely tied together. Evolutionary biology, genetics, and organic chemistry. And a lot of these classes are repeated around majors because a lot of STEM majors overlap, such as when you have biology and chemistry overlapping or chemistry and physics overlapping. And majoring in biology can help you ensure that you complete the prerequisite science courses and labs that medical schools require. So pre-med isn't a major, it's a track. So you have different majors that you can choose and prerequisites that medical schools require you to complete before you apply. And majoring in biology can help you ensure that you complete all of those prerequisite courses. And those can also range between different schools. So as you're applying for different medical schools, make sure to do your research on each one and complete all the prerequisites. And then we have our chemistry major. So most chemistry majors will pursue careers as medical laboratory scientists or physician assistants or biomedical chemists or veterinarians. And the classes that a typical chemistry major will take is principles of chemistry, calculus, physical and analytical chemistry, inorganic and organic chemistry, chemistry labs, and then fundamentals of chemical measurements. So there's also many different types of chemistry, as you can see, where there's the principles of chemistry, physical and analytical, and then you have your inorganic and organic. And having a chemistry degree can help you develop laboratory techniques, which are really important in healthcare. And as stated before, it overlaps with certain areas of biology, physics, engineering, and earth sciences. So it'll help you develop skills in those fields as well. And like keep in mind that pursuing one major can also help you develop skills in another one. So for example, if you majored in math, that could help you think more critically. And that would help you develop the like detail-oriented skills that you would need to become, for example, a doctor or a surgeon. And then we have our physics major. So many physics majors will pursue postdoctoral fellowships. So that's kind of like research that you do after you graduate. And they can implement human research laboratory experiments and also like continue their research in a specialized field. And some of them also will have careers as research associates or medical technologists, nuclear medical technologists, and radiation therapists. So some classes that typical physics majors will take are mechanics and waves, foundations and seminars in modern physics, multivariable calculus, electricity and magnetism, vibrations, waves and optics, quantum physics, and statistical mechanics and thermodynamics. And physics degrees will help train you to have expert problem-solving skills, research skills, and analytical skills. So much like a biology and chemistry major would help you develop those skills as well. And here are some careers that you can pursue with a biology degree that might not be in the medical field or even in the medical field, but not in a hospital setting. So, for example, you could be a natural science manager, working with the environment, climate change, and also planning, directing, and coordinating activities in fields of life or like physical sciences and be pursuing research in those fields. You could become a general biologist. You could study the basic principles of plant and animal life and ecology or molecular and cell biologists who research and study molecules and organelles, and that helps us understand cell function. You could be a forensic or a science technician, and they help collect physical evidence like hair or tissue, and then they would be in a laboratory identifying and classifying and analyzing those pieces of evidence related to criminal investigations. There are microbiologists who investigate the growth, structure, and development of microscopic organisms, such as bacteria or fungus, and the effects of antibiotics on those microorganisms. So that's also very important in healthcare for us to know how effective our antibiotics and medicines are. And finally, there's biochemists and biophysicists. So these study the chemical composition or physical principles of living cells and organisms. And after they study those, it can determine the effects of food, drugs, and other substances that can be very important for things like nutrition and managing cholesterol or your blood glucose levels. And then here's some careers that you can pursue with a chemistry degree. So, for example, you have water chemists who study and monitor the presence of chemicals in water, and that can play a large role in health to make sure that we all have clean water to drink. Um, And if those types of water aren't clean, then they'll be the people who make the regulations and policies to process that water to purify. And then we have analytical chemists who study toxic substances and they will develop pharmaceuticals or work in a lab and participate in specialties like forensics or toxicology. You have synthetic chemists who test and develop chemical compounds to create new materials, and these synthetic chemists usually work in fields like healthcare, manufacturing, or even in food fields. And then you have organic chemists who will research and manipulate different elements and materials, kind of like how we talked about in our chemistry major. And then we have pharmacologists who will perform studies on new and existing drugs and study the source and the chemical makeup of those drugs. So they'll be studying the effects of those drugs on humans and animals. And that's really important for healthcare because we need to know if those things are safe for humans to use, if it's safe to treat different diseases or illnesses. And finally, we have toxicologists who will test various blood and tissue samples to detect the presence of pharmaceuticals, poison, and alcohol. And then here are some of the majors that are more specific to medicine. So as we covered before, pre-med isn't a major at universities, but it's a track that you could take, and that track encompasses a lot of required courses. So most pre-med students major in the following: biology, you have biochemistry, biomedical engineering. A lot of doctors major in nursing, psychology, and public health, and we'll have a separate presentation on public health in November where we can dive into it more in depth then. We have math and statistics, foreign language, exercise science, and since there are so many, we'll only be covering the ones with asterisks, but you can always ask questions about the other ones if you haven't. So biomedical engineering. Biomedical engineers are people who help create or improve devices like heart monitors and diagnostic machines. And they also work on creating artificial devices like artificial organs that can be transplanted into um, people's bodies. And that is really helpful for healthcare because, as you know, in healthcare, a lot of people need donated organs, and that list can be very long, and people can start to give up hope that they'll receive those organs that they need. And as a biomedical engineer, as you're creating these artificial organs that can be transplanted into people's bodies, you can give a lot of hope to people who are waiting for organ donors. And these classes that typical biochemical engineering majors will take are biology, chemistry, and physics, so the three major groups that we talked about, anatomy and physiology, because they'll need to know the different functions of the bodies and if those artificial organs will be connected and function correctly. Biomolecular engineering, medical diagnostics, so they can work with those heart monitors and diagnostic machines, and finally, biomechanics and bioelectrics. And having a major in biomedical engineering can help you prepare for medical school. It'll make sure that you take all the required courses. It also improve knowledge about tools that you might be using as a doctor or a medical professional in the future. And then we have our nursing major. So most of the students who major in nursing will become registered nurses or nurse practitioners, and they can follow that as a pathway into medical school. And most nursing programs will include the prerequisite courses for medical school, so you won't have to worry about making those up another time. And they can also require you to complete internships in a hospital or clinical setting, so you can really put your textbook skills or skills that you've learned in class to use in a hospital setting. And a lot of universities will set you up with these internships or have resources that you can use to go there, so you won't have to worry about that either. And these are some classes that typical nursing majors will take. So we see some that were repeated, biology, chemistry, and physics, anatomy and physiology. There's also nursing ethics, which is a class that you'll have to take um, just to learn about like what it means to be a nurse, different types of care that your patients might need, health assessment, clinical theory, pharmacology, patient care practices, and then sociology and psychology. And then we have our psychology major, which is a degree for future physicians who are, and that's often preferred by medical school because majoring in psychology can set you apart from biology and chemistry students. And that's not to say that biology or chemistry aren't good majors for medical school, but having one that isn't bio or chemistry can set you apart from other people who are applying there. It shows off like humanistic approaches to medical careers, and it can help you develop skills like empathy, critical thinking, communication, and resilience, and also teach you a lot about brain functions and how the brain works. And some of the classes that typical psychology majors will take are the different types of psychology. You have your general psychology, developmental psychology, clinical psychology, social psychology, and cognitive psychology, and then finally educational psychology. Um, and all these different types of psychology will just go into like the psychology major and teach you all the different facets of that major. You have statistics, and then psychiatry, neuroscience, and psychological disorders. And then many schools will offer you a specialization, or you can choose to take a pre-med track as you're majoring in psychology to ensure that you have all the prerequisites for medical school. Because you notice that doesn't have biology or chemistry or physics or anatomy or physiology. So you can choose a specialization that allows you to take all of those prerequisite courses. And then we have our mathematics major overview. So math and statistics majors can help prepare students for medical school, even though it's not science major like biology or chemistry. And even though it's a little bit difficult, some of the doctors who have majored in math kind of say that putting in the hard work and developing those critical analytical skills in their mathematics majors will help them prepare for the hard work that is required from a medical school student. And the courses that typical math and statistics majors will take are the same types of math that you'll be taking in high school. So algebra, geometry, and calculus, the more advanced. You have statistics, data science, probability, foundations of mathematics, computer science, and analysis. And these math courses can help you think critically and analytically, and that can help you think of different approaches when you're treating a patient, or develop the precision that's required from a doctor or surgeon, or even like the detail-oriented skills that you'll need to become a surgeon. And then we have our foreign language major. So good communication is a really big part of working in the medical field. And like, for example, in the United States, since there's so many different people, we're a really diverse country. There's people that speak a lot of different languages, and being able to communicate with them is something that can set you apart from other medical school applicants. So over 10,000 of the employed doctors and surgeons who got a job in 2015 majored in a foreign language. And the classes that your typical foreign language major requires are conversation, grammar and composition, literature, linguistics, writing, and cultural studies, and all in your foreign language. Um, and for this major, you'll have to fulfill your prerequisites for medical school. But some of the schools will offer courses like your language for healthcare. So, for example, if you were taking Spanish, it would be Spanish for healthcare, and you would learn how to communicate in a hospital setting with your language, as well as outside of that hospital setting. And then we have some other careers in STEM that you can pursue, and those are relating to medicine or not. And for example, majoring in biology sets you on a path where you have so many different options. You could go into like emergency medicine, working in the ER and making sure that people get the care as soon as they need. General medicine, so like checkups, making sure that everyone is healthy throughout the years. Pathology, you have pediatrics to work with children, anesthetics to make sure that um, people can properly perform surgeries painlessly, all the way to neurology and cardiology. And then we have some non-medicine related careers in STEM, so like patent law, where you can be people that put patents on, like, for example, those artificial organs that can be approved for people to use. You can have international relations, where you can talk to other countries about their public health policies. So, for example, universal healthcare. Local public health. So, like if you are an SF working for the city and making sure that everyone in SF gets the care that they need. You have environmental science, research affiliates, all the way down to nuclear engineers and chemical engineering, and also data analysis. And there are just so many fields in STEM. It's like a vast field. It's constantly growing. So we won't be able to cover all of the careers that are in that field, or maybe we won't ever be able to cover them all because there's so many of them. But they are amazing careers to have, and we encourage you to continue to broaden your horizons and look into different careers. And with that said, here are three pathways into a career in medicine. So you can pursue an MD, a PhD, or a combination of both your MD and PhD. And the first one we'll be going over is your MD. So pathway here, the undergraduate degree usually takes about 4 years. So from the time when you're 18 to when you're 22. And your first 2 years are advanced science coursework. So that'll be in the classroom where you're learning from a textbook. And then the 2 years after that are clinical experience and patient exposure. So starting there, you're really in a hospital and learning how to put those skills that you're learning in the classroom to a hospital setting and actually dealing with real life patients. And then you have clinical rotations to apply skills that are learned in your class to a hospital setting, like we just mentioned, but those clinical rotations will be after those 2 years of training with a supervisor. And then during those 4 years, you should look into taking the United States Medical Licensing Exam, parts 1 and 2. There are 3 parts to get a license to practice, but you'll want to complete the first 2 parts during medical school. And then you have your residency, so that lasts anywhere between 3 to 7 years, and you will have a partial salary. And you'll also gain lots of hands-on experience under supervision of someone who is already a doctor in that field or maybe already specializes in that field. And the length of your residency really depends on your field. So some fields like psychiatry or psychology, those take anywhere between 3 to 4 years. But for example, if you're majoring in a field like neurosurgery, or even cardiac surgery, that could take up to 7 years. And during this time, you should look into taking part 3 of your licensing exam so that you can acquire a medical license. And then you have an optional fellowship, which lasts anywhere between 1 to 3 years. And that's additional research in your specific field of study. And that can help you become more skilled in a subspecialty in your fields. And then after that, you would want to acquire your medical license, which can take about 2 months. You can apply for a medical license in your third year of residency, so after you've completed the licensing exam. And you have to typically wait 2 months for a license to practice in your state after submitting your application. But after receiving that license, then you are a practitioner, and you can become a doctor in your state. And then we have a pathway to a PhD, which is the highest level degree you can earn. They're designed to be finished in 4 or 5 years, but some of them can take anywhere from 6 to 12 years to earn and complete. And some of the terms that we'll be using, you can see on the bottom, PhD requirements. Advanced coursework is graduate level coursework that you'll be using to explore subtopics in your field of study. And you have your comprehensive exam, which is an exam that requires you to show knowledge of your field. You'll be taking that in your third year of PhD. And that exam can include anything from like the history of your topic to the important figures in your field. So, for example, in biology, that would be like Rosalind Franklin, Watson and Crick, discovering DNA. And that can also include major theories or research that people have previously done in your fields. So you have to know like the ins and out of your field, all the science parts of it, also um, the history of it. And then you have your dissertation, which is an original body of research that you contribute to your field. So that's something that you'll have to research on your own, something completely new that you'll give to your field. In the first 2 years of your PhD, you'll be completing advanced coursework and preparing for your comprehensive exams. And then during your third year, you'll have to study for and take those comprehensive exams. And then that's when you'll begin to formulate and research your dissertation proposal. And then in your fourth year, you'll be submitting and working on your dissertation, so conducting all the research that that takes. And that's where it might take longer than 4 to 5 years because some fields, those types of research take a really long time. And then in your fifth year, you'll have to finish writing your dissertation. And when you're finished writing it, you'll apply and then defend that to a committee. And if your dissertation is successful and you successfully defend it to a committee of people, then you can apply for graduation. And after that, you'll have your PhD, and you'll have that degree. And then finally, we have the pathway to an MD PhD. So people who hold this degree are known as physician scientists or medical scientists, and that's a 7 to 8 year long program and usually requires attendance to both medical and graduate school. So for your first 2 years, they'll be very classroom based, and that's like the typical first 2 years of medical school. And then for years 3 to 6, you'll attend grad school and complete your PhD thesis, your dissertation. And then for years 7 to 8, you'll have to return to medical school and complete those clinical rotations where you're taking the things that you learned in your first 2 years and applying them to a hospital setting. And here are some notes about the MD PhD program as opposed to MD. So there's higher competition because there's far fewer combined MD PhD programs available. There's usually more individual MD programs or individual PhD programs. So they'll typically accept applicants with higher undergraduate GPAs and higher MCAT scores. And the MCAT is a exam that you take to apply to medical school, like how you would take the SAT to apply to college, or even the SSAT if you're in middle school applying to a private high school. And the cost and debt. So most MD students will accumulate hundreds of thousands of debt in over the years, but a lot of MD PhD programs can actually partially cover your tuition or even completely waive tuition for their students. So just keep in mind that those are 3 pathways that you have, and you don't necessarily have to go to medical school only. You can always go to grad school or even a combination of both. And with that said, are there any questions?